Most of modern medicine is discovered through trial and error. It's the errors in our past which cause us to reflect and change our current practices. This applies not only to medications or procedures, but how the hospitals themselves run. And one of the most important parts of any training hospital is the resident doctor. They are the doctors in training who care for patients overnight, do the scut work no one else wants to, and carry around the pager. And before 2003, resident doctors often worked 90 to 100 hours a week, living and residing in the hospitals where they worked, hence the name residents. But in 2003, after nearly 100 years, resident doctors were capped at 80 hours a week. So what led resident physicians to have their hours capped? And is this limit itself too high? On a rainy, cold night in New York City, 18-year-old Libby Zion presented to the emergency room. She seemed like any other college student coming into the ED with a flu-like illness. Two resident physicians, a second-year and intern, evaluated her in the emergency room. They didn't know the exact cause of her flu, as there are thousands of circulating viral strands at any time that could be the culprit. Her past medical history was only significant for major depressive disorder, controlled on a medication called phenelzine. Yet something stood out in their exam. She wasn't just complaining of a stuffy nose, fever, and cough. She also had these strange, jerking movements. This is where the case took a turn for the worst. The resident doctors didn't know the cause of the jerking movements, but were resolved to treat her. They called up her family physician, who agreed with their plan. The team decided to treat Libby with a drug called pethidine. Pethidine, otherwise known as meperidine, is an analgesic like an opioid, and they thought it would treat her jerky movements and also calm her down. Since the residents have to see dozens of patients in the night, they left Libby to continue with their rounds, leaving the nurse to administer the medication. But the meperidine had the exact opposite effect of what the two residents intended. Instead of calming down, Libby seemed to grow even more agitated. So agitated, the nurse taking care of her sent an urgent page to the resident, saying the patient was more confused and pulling at her IV line. The residents knew a patient who was this altered was a danger to themselves and the staff taking care of her. Therefore, they ordered physical restraints on Libby, and when she fought against these restraints, the residents ordered haloperidol, a common medication used to treat agitation, and it finally seemed Libby fell asleep. But it wasn't a natural sleep. When the nurse took her temperature the next morning, it had risen to an incredible 107 degrees Fahrenheit. Her body was literally cooking itself. The two patients rushed to Libby's bed and started immediate measures to bring her body temperature down, but it was too late. Her temperature was too high for the normal functioning of her internal organs, and she passed away on March 5, 1984. So what caused her death? With the benefit of hindsight, it's clear she died of something called serotonin syndrome. This is a very rare condition when a patient has too much serotonin in their central nervous system. It's caused by a terrible reaction between the medication she was already taking, phenelzine for her depression, and the drug she was given for her jerky movements, pethidine. See, both of these drugs release serotonin in the synapses between neurons. If there's too much serotonin released, patients get fever, disorientation, spasmodic movements, and agitation. Sound familiar? Libby Zion exhibited those exact symptoms, and unfortunately, the residents did not correctly diagnose her. Now, if Libby had a different family, residents today might still be working more than 80 hours. But it was the subsequent push by her father, Sidney Zion, who, in his grief, persecuted not just the doctors, but the entire medical system. Sidney Zion was a famous criminal lawyer, eventually turned writer and journalist. He charged that residents who are routinely working 100 to 120 hours a week, and oftentimes 36 hours at a stretch, could not make sound medical decisions. Sidney led a public campaign to bring the doctors to justice, going so far as to charge the two resident doctors with murder. Now, a grand jury refused to accept a murder charge, but did decide to prosecute the two residents for gross negligence. The trial heard testimony from dozens of expert witnesses, including 6 chairs of different internal medicine departments. Many of the leading doctors testified they had never heard of an interaction between phenelzine and pethidine. At the end of the trial in 1987, all 38 charges of gross negligence were dropped against the residents. In a subsequent civil trial, the jury decided the hospital itself was negligent for leaving a resident alone to tend to 40 patients in a night. And honestly, something that happens very routinely in hospitals all across the United States and even now. The jury also ordered the hospital to pay a fine. After the dust had settled, it was clear the residents, while obviously overworked, had not necessarily made a decision of wanton negligence. In fact, many doctors who had finished their training and were leaders in their field said they would have made the same decisions. But the public in the city of New York now knew how much residents were working, and the spotlight was on resident work hours. New York City appointed a blue ribbon panel of experts to investigate resident training. In 1987, this commission recommended doctors in training should work no more than 80 hours a week and no more than 24 hours at a time. And in 2003, 16 years later, the body for resident education in the United States, the ACGME, made these guidelines mandatory for all residency training programs across the country. So that's how the death of one patient and the grief of a father led to the modern cap of 80 hours a week for residents. I think it also helped that the general public was appalled by how long doctors were legally allowed to work before sleeping. In comparison, truck drivers are only allowed to drive for a continuous 11 hours before they are required to take a break to sleep. Still, many resident doctors in the United States work 80 hours or more a week and are often on shift for more than 24 hours at a time. Some people argue this amount of time is necessary to train effective doctors. Others argue that these shifts put patient lives at danger by putting the least trained doctors under a high load of patients when they readily can't receive support from their senior residents and attendings. So, the debate still rages on over resident training hours. But let me know what you think in the comments, and thank you for watching.